Good morning, everybody. Happy Tuesday. Hey, we're here to talk about something that I think we can all relate to. We've got the Bone and Joint Institute with us. Dave Kempfert is here with me. We're going to talk about working from home and the aches and pains that sometimes are associated with working from home. And we don't mean the inconveniences. We're talking about actually where you sit, how you sit, and how you function all day. How's it going this morning?
Good. Thank you, Donna. Good to see you.
Yes, you too. So let's talk about working from home. I know that I sometimes don't necessarily sit at a desk all day. I will move around throughout the day, which sometimes ends up giving me a backache at the end of the day. So let's talk about that. What are the most common aches and pains associated sometimes with working from home?
I think a lot of it is obviously this year we've seen a lot more people working from home and transitioning, even if it's just more part-time at home versus being in the office. And we don't really have workstations that are kind of built for that at home a lot of the time, right? So people are working from their beds, they're working from couches, they're working from dining room tables that might not be the right height. So a lot of times the things that we'll see more in when people come in and talk to us in rehab is more neck pain, kind of shoulder pain, upper trap muscles, these kind of things, just from being in kind of poor working position. So maybe you're not working out of your standard office chair. Maybe your computer monitors at a different height, or you're off a laptop at home, and maybe at work you're at a desktop, and those type of things. So a lot of it seems to be positioning issues. So things that affect posture, neck, upper back, and then a lot of times too, we'll see pains with wrist and elbow kind of pain just from maybe working at not perfect heights. And so reaching a little bit more and just kind of repetitive kind of strain issues is what we'll see more in rehab.
Is there something we could do at home, like maybe better equipment or things we could have at home that would help alleviate some of this?
Yeah, there's definitely some things that you can do. The first thing I think is always position, like we talked about. So, trying to work at a table that's an appropriate height. We talk about something called the rule of 90s. So when you're working at a laptop, or even if you're just reading or writing, getting yourself in a position where you can kind of sit yourself back better than I'm sitting now. Sit yourself back in the chair. And try to keep about a 90-degree angle at your hips and a 90-degree angle at your knees with your feet flat on the floor. And then when you're working at a desk, or if you're on your laptop, keeping your elbows at about 90 degrees. So your arms are out in front of you. You're not overreaching too far. So you can kind of maneuver things with your elbows pretty close to your side or a little bit in front. And those are kind of the positional things. The height of the monitor makes a big difference too. A lot of times, if we don't have the monitor at the right height, we'll catch ourselves kind of this forward head, forward shoulder posture. And if we stay there for a long time, when we get busy, we don't realize the effect that has on us over time and the neck strain that can cause. Other things that can help too is using like a monitor stand to kind of get things at the right height, or using even just like a document holder. So a lot of times people they'll be working and they'll be reading and they're looking down at these angles, and getting a document holder so you can kind of read those things, keep your head and your shoulders back a little bit more in better posture. Sometimes another thing too is if we don't have a great office chair, a lot of us have heard of using like lumbar rolls or lumbar supports. And a lot of times, our dining room chairs and those things, or couches, definitely don't have those things. So sometimes just sitting with your rear end back in a little bit of a firmer chair rather than a soft chair or couch, and using like a rolled up sweatshirt or a towel, and just put that in your low back just to kind of fill in that normal little curve we have in our low back. And generally what happens is you sit up there, that's a little better for your low back, but it also helps keep your shoulders and your upper chest kind of back a little bit. So even putting a little curve in your low back helps kind of upper thoracic spine and neck postures as well.
As I sit here and I'm like trying to move my shoulders as you're talking here, I'm like, okay, I'm trying to make aware of that.
Yeah, and that's the reality of it. Is, I tell people all the time, like, you're not going to be perfect at it. Nobody is. But for every minute more you trade out of good posture for this poor posture that we tend to have, can make a big difference over the course of a day and weeks and months of working from home or working in bad positions. So every little bit helps.
What are some things that we can do while we're at home? I think I've heard you say taking breaks are good. Get up and walk around. And
yeah, definitely some things, just moving. Okay. We don't realize like how long we can sit there, right, and stare at a monitor, stare at a screen. So I always tell people, try to get up and move, even if it's just walking around the desk and then sitting back down. Try to do some kind of movement every hour. Get up and walk a little bit. If you can't, or even when you can do those things, it is good every once in a while just to do some gentle shrugs with like a little backward roll, and just sitting in good posture. So having your head up, and I'll tell people, think about like a string pulling you tall from the top of your head. Okay. Like my spiky hair there. Okay. If you're pulling that up, Okay. But to shrug and roll your shoulders backwards kind of helps open your chest up, stretch your pec muscles out a little bit, and helps you get in better posture. The other thing is doing just some regular shoulder blade squeezes. So just opening up and pinching your shoulder blades together, holding it for like a little pause, and then coming forward. And again, that kind of strengthens some of the muscles in your back, but helps you get in good posture, keeps the blood flowing, keeps your muscles relaxed a little bit. Other things that tend to be good is especially if you're using a monitor and we use our hands and our wrists so much, is to do some elbow stretches. So a lot of times, I don't know how well you can see me here, but to have your elbow straight and then do some stretches where you pull your wrist down, and that helps stretch kind of the outside part of your elbow. And then you can turn your palm up. Let's see if I can get there, and pull down like this. So those kind of stretches are good to kind of help loosen up your forearms. Other things that you can do is just to lean over a nice straight leg. So have your legs straight out in front of you and then reaching out and stretching over a straight leg, just to kind of stretch your hamstrings at the back of your thigh. All those things kind of help a little bit. If you're getting a lot of low back pain, sometimes just in a seated position, just kind of scooch to the front of the chair and just round your back like you're reaching both hands between your legs and stretching for the floor. A lot of times those things, when you're having to sit for a long period of time, those things can give you a little bit of relief, keep you moving, keep the blood flow going, and help keep you kind of relaxed during your workday.
Wow, those are great tips. So let's say we've done all those. We've done all your things that you asked us to do in the stretches. When should we come see you and take a visit and say, I'm still having this lower back pain or these shoulders or my neck?
Right.
When is the time to come see you?
Well, it depends. Obviously, if somebody's having a lot of significant pain or it's getting worse and worse, you don't want to wait too long. I think most of us do wait too long. It's just the nature of things. We tend to say, oh, I've had this before. And it usually resolves in 3 days or whatever. And so when those things happen and you realize like, okay, this isn't resolving, something's different about this time, or it's getting more and more significantly worse as far as pain goes, or really starting to limit your function. So, people come in and like, I didn't realize how bad it was until I went to tie my shoes and realized like I couldn't reach my shoes anymore. So, those types of things are obviously big signs of hurting. The other thing too is if people are having some, low back pain or strain, we're all kind of used to having that at times. It usually resolves on itself. But a lot of times people start to get sciatica, if you've heard of that, where you'll start to get pain that's kind of shooting down into your buttock, down the back of your thigh. Any type of like neurological symptoms, you want to get checked out. So if someone's having weakness in their leg, numbness and tingling, electrical kind of pain down into their lower extremities, those are things you want to get checked out. Most of the time it's very, very treatable with medication and physical therapy and those type of things, sometimes without meds at all. Most of the time we don't even need to do any imaging for things like that. If it's something that looks significant, that, the doctors can, but most things are very treatable with just, kind of working on posture and showing people some stretching, some strengthening. And sometimes the biggest thing we do as physical therapists is the educational part. So teaching people what not to do sometimes can be just as important as teaching them what to do for exercises. But I think those are kind of the key things to look for, is something's different about this episode. Or obviously if it's been a while and it's not getting better, it's always better to get it checked out before it turns into something that's a big problem now. Yeah.
Well, hey, thanks for letting us talk to you this morning and learn all about tips for working at home. Hey, you guys, if you need help, please go see the Bone and Joint Institute here in Franklin, and they will get you all set up, because we're all going to be here for a while, I think, still working from home a little bit in some capacity or another. All right. Hey, thanks for joining us this morning. We will see you back soon.
You're more than welcome. Thank you, Donna. Have a great day.